drivers of homelessness, as this is poverty very much created by policy. And so, yeah, I won't be taking a broader view, but very much focusing on those particular issues, acknowledging, of course, that there are a whole range of structural and individual factors at play in which result in homelessness for people. And acknowledging, I'm coming to you from Sydney on the Gadigal land of the Eora people. So I thought let's just start with, I guess, just the basic facts in terms of the current situation and what are payment rates now for people who are relying exclusively on income support payments for their income. And you'll be aware, I think many of you, that there were some changes made in the federal budget this year, which have affected an increase in payments, albeit not sufficient. So I've just put the current rates there on the slide for you all. There was a $40 a fortnight, $20 a week increase to JobSeeker announced in the budget, which was, whilst significant and welcome, not substantial enough to address the fairly dire inadequacy of the payment. So that takes the payment to $749.20 a fortnight, or $56 a day, which is how we usually refer to it. Youth allowance, you can see there's significantly lower, $44 a day. And the most recent budget also included a 15% increase to rent assistance payments. Again, not insignificant, but not substantial enough to really affect any change in the levels of rental stress being experienced across the population. And clearly, the cost of rent and the ability to pay rent is a key factor in causing homelessness. And there were changes to eligibility to parenting payment, with single parents with children now aged 8 to 14 years, again, eligible to be receiving that higher pension payment. So that's a significant increase for those households, up to $922 a fortnight, or $66 a day. But to put that in global context, and this data was put together, this comparison was done prior to the 2023 budget. So there has been some slight change, obviously, in terms of the dollar per week figure in Australia. But I think it would only be shifting us at the margins. I mean, we're still at the back of the pack, at least in, the bottom 3 or 4, even if not still right at the very back as we were prior to that $20 a week increase. But you can see that by international comparison, in the context of other wealthy developed countries in the world, we fare very poorly in terms of the level of our unemployment benefit compared to wages prior to unemployment. And then if we look at the trends over time, and really what I'm trying to do here is just really illustrate to you the inadequacy story. Why is the job seeker payment and allowance payments as more generally, how have they become so inadequate, and why? How do those rates compare with other key metrics? So this graph compares the rate of job seeker, which is the red line at the very bottom. You'll usually find the job seeker line at the very bottom of these graphs. It's the red line. You'll see the peak there in 2020-21 during the COVID crisis. You can see the top line being average wages. The dark blue line is minimum wages, which track fairly significantly above the poverty line. And so do protect households generally if they're in full-time work from poverty, if they don't have children. And that's where the family payment system is really meant to play a role in preventing child poverty. But the other important thing to note here is the trends in pension. So you can see that the pension and job seeker rates were around about the same in the early 90s, but that over time those payments have diverged significantly, with that lapse that in 2020-21, where we had the COVID supplement, which closed the gap. And in fact, for a period there, job seeker households were receiving higher incomes than pension households. But now we're back to normal policy settings. You can see that widening gap over time between pension payments and allowance payments. And that's an indexation story, as well as the fact that pensions have benefited from some one-off increases from time to time, which until the October budget, job seeker allowance recipients had not received. And then if we compare the job seeker payment rate with the poverty line, which is another key measure, it tells us some things, not everything, but it's not unuseful in both assessing adequacy but also tracking trends over time. And you can see there again that that the single payment rate falls well below the poverty line. It got closer to it in COVID with the supplement, whilst you can see there, well, median income tracking much higher, poverty line set at 50% of median income. And so we've got what we would call a fairly deep or severe poverty gap. The gap between the poverty line and allowance payments is very significant. It's not at the margins, it's very significant. Which you can see in this graph, which presents the rate of job seeker, the blue wiggly line, and the couple rate is the red line. But you can, for simplicity, just look at the dark blue line compared to the flat poverty line, and you can see how significantly below that line it is, and has been for a long time. Again, apart from that COVID experience, which showed, that where there's a will, we can resolve poverty. So there's a number of policy proposals that ACOSS has developed and is advocating to try and address these fundamental inadequacies in payment rates. I suppose fundamentally it's about lifting the job seeker and other allowance payments to the same rate as pensions, pension parity. We don't accept that there is any valid argument for those payments being set at different levels when the costs that households face are the same. The only argument historically has really been a moral one about so-called deservingness. And the other argument that governments often proffer is really a flawed one, which is that people on job seeker are only on the payment for a short period of time, when we know now that more than 3/4 of people on job seeker are long-term recipients of the payment. So they're on it for more than 12 months. I meant to come back and put in how many dollars a week that increase was when I was doing these slides, and you can see I haven't done that, but I think it's on the earlier slide, and it's certainly in all of our materials on this. But the other really important thing is indexing the payments both to wage and price movements, because as you saw before in that graph, that's really what's driven the huge gap between the pension and allowance payments over time, is that pensions are indexed to both wages and price movements, allowances just to prices. And the usual trend has been for wages to rise much more quickly. So they should be indexed in the same way, so they keep aligned over time. We propose that rent assistance be reformed, notwithstanding the 15% increase. There's a lot more that needs to be done. That it should actually be benchmarked to actual rents paid, and it should be indexed, and ideally indexed to some rent price index, movement index, e.g. the rental component of CPI. But more broadly, there are some fundamental issues, I think, with the design of rent assistance, the eligibility rules, etc., which mean, for example, that because it's a secondary payment, so you have to receive an income support payment of some kind in order to be able to receive rent assistance, that there are many households who can't get rent assistance even though their incomes are very low. For example, single people who are on minimum wage and facing high rental costs. So there is a need to have another look at eligibility and the targeting of rent assistance. We've suggested that work could be undertaken by the Economic Inclusion Advisory Committee, and maybe I'll jump to that proposal quickly, which is number 5. So some of you would know, an interim Economic Inclusion Advisory Committee was established last year and presented its first report to government prior to the May budget on social security adequacy. And its key finding was that, well, that the job seeker payment is grossly inadequate, that it's finding that it should ideally be set at a rate of 90% of the pension. We say parity, they say 90%. I mean, we were fairly pleased that where they got to, that was a significant step. And really important that body then be legislated, which will be happening, I think, this year, that it be set up in a way that is permanent, that it's transparent, that its reports are produced in a timely way and are made public, and of course that its composition ensures adequate representation of people directly affected by social security policy. And so, yeah, I encourage people to keep an eye out for that legislation and engage with that process, because, I mean, our view is it has the potential to be a game changer from Social Security payment settings being made on the basis of moral rather than the basis of need, moral arguments rather than on a basis of assessed need or evidence of need. And there's a lot of evidence out there about payment adequacy and need, whether it's on deprivation, poverty lines, budget standards, and they all highlight the need for these payments to be substantially increased. So that, I suppose, the EIAC recommendation is really about a change to the institutional and policy decision-making processes around Social Security, to depoliticise them to some extent. And the other important part of our set of policy proposals is around the creation of an additional supplement which recognises the specific and extra costs of disability for those people who are not on the DSP but are on an allowance payment, and for single parents who have the additional costs of raising children alone. So those are the policy proposals. They're set out in more detail in our federal budget submission, and more recently in our submission to the social safety net legislation bill. So then when we model those visually, just so you can see, let me just hide that window so I can see the bottom of the graph. You can see there the blue, and maybe just focus on the first column, which is just job seeker for simplicity's sake. There's the current rate, and then the budget increase, which is the red part, which takes it to 371. That will come into effect in September. The yellow bar is where the EIAC would set payment rates if it were set at 90%. And then you can see the dark blue line would take it to parity with pensions. And you can see in the second column, it's the combination of those changes plus the CRA with the increase. And just finally, in terms of making the case for adequacy, the budget standards evidence that I referred to before is really useful to cite, I think, in this advocacy. It's just been updated by Bruce Bradbury and his team at UNSW. And what it does is it models household budgets for different kinds of households. And obviously you can compare those with payment rates, and you can see there the single person, that first column, you're talking about needing a minimum of $946 a week just to meet those basic costs. With housing there, you're looking at $452 a week. And then you compare that, of course, to payment rates, and I think the case is fairly clear. This evidence was prepared for the Fair Work Commission to inform their work in making recommendations about the minimum wage, but it should also be used, we would say, to inform the rate at which payments are set. So yeah, I'll leave it there, and I'm happy to take questions or engage in a discussion about the relevance of these recommendations to the current process. And I'll just see if I can hop out.
So much, Jackie. So I'll move on to Guy. So Guy Johnson's the Professor of Urban Housing and Homelessness at RMIT, and also the Director of the Unison Housing Research Lab. But particularly sort of in those roles and in others previously, has done lots and lots of research about homelessness, exploring what the pathways into homelessness look like, what the pathways out of homelessness look like, and so is very well positioned to talk to us about what's needed to prevent homelessness, and also worth noting that Guy's also worked in the homelessness sector, so understands how it all works. So over to you, Guy.
Thank you. Thanks. I'll get to the slides in a moment. Thanks, Kate. Thanks for that. Thanks, people, for turning up. I mean, why I'm happy to talk about prevention is it's important, because we hear a lot about wanting to end homelessness, and you simply cannot end homelessness without a strong and clear focus on prevention. No country has ever solved homelessness by funding or building more emergency accommodation. It simply doesn't work. But homelessness prevention is really hard, and it's hard to do because the onset of homelessness is very hard to predict. Jacqueline mentioned income support and poverty. And these are really important and are deeply implicated in homelessness and the onset of homelessness. But the question that we've got to ask as researchers and as practitioners, why do some poor people or some people experiencing poverty experience homelessness and some don't? Poverty's there in some cases as a key driver, in other cases it's not. Why do some unemployed people experience homelessness and others don't? We can turn this around into a range of other features that are well known amongst the homeless population. We know trauma is disproportionately represented amongst the homeless population, but not all people who experience trauma end up homeless. Prevention's also really hard to study because how do you examine something that hasn't actually happened? It's possible to do this, but it's also bloody expensive to do. There's two messages I want to get across today, and hoping I can get those the slides up. The first, we need to think about prevention in terms of both its impact on the aggregate level of homelessness, the size of the homeless population, but also its impact on the composition of the homeless population. Who's in that population? Okay. Second, and this is really important, we need to recognise that individual risk factors are far less powerful predictors of becoming homeless than we think. Okay, we have really strong evidence supporting this. If we're thinking about homeless prevention, there are two areas that we need to look at. The first, obviously, is the condition of the housing markets. And I've got to say, in Australia, we tend to do that quite well. Not talking about the condition of their housing markets, but our advocacy is well focused on trying to increase the supply of social and affordable housing. Where we're lacking a little bit in the homelessness space is a focus on the welfare support systems and the breadth and depth of those. And that's not just simply income support. This includes things like our health system, drug and alcohol services, mental health services, but also things like childcare. They have an implication in terms of setting up a systematic approach to preventing homelessness and improving the general well-being of the community. Okay, there's two parts to the presentation, and I'm going to first, in the first part, I'm going to actually look at two international studies to try and understand the impact of welfare systems, different welfare systems, on not the aggregate level of homelessness per se. The two countries are Denmark and the US, and they have very different numbers in terms of the homeless population, in terms of the size of the homeless population. But I'm more interested in terms of the impact on the composition of the homeless population and what that means and the implications in terms of homeless systems responses. Then I want to have a look at some work from Journeys Home. I'm not sure how familiar people are with Journeys Home. Ironically, it was funded through the last federal government's homelessness strategy in 2009 and is considered far and away the best data set in homelessness to model entries and exits into homelessness. Okay, now we get to the tricky stage where coming up simply won't work. All right, then let me just work through this in a slightly old-fashioned sort of a way. Okay, and again, apologies to people. There's two studies that you need to know about. One was done in America by two researchers by the name of Kuhn and Culhane, and the other one's from a study done in Denmark by Lars Benjaminsen and Andrade. Now, both of these studies are interesting for different reasons, though. So let me start with the Kuhn and Culhane paper. What they did was look at shelter use, okay? They looked at shelter use patterns in the US and they used administrative data for that. What they actually found was there was a number of quite important patterns. Those patterns were that people use shelters in different ways. Some people use them sporadically and once, others use them many, many, many times. So they labeled the three groups: transitional, episodic, and chronic. The important point about that was the characteristics of the group differed, or the groups differed. Amongst those who were chronic users who disproportionately used homeless services, about 8 or 10% of the population of the sample were chronic users. They found high rates of mental health problems, substance use issues, high rates of complex needs. Whereas if we think of this in terms of a continuum, those at the other end of the continuum, those who were episodic transitional users, that's about 80%, they were just simply poor. They simply didn't have enough money to afford housing. So we see on a continuum ranging from very complex needs to very low sets of needs. Now, the study was hugely important in America in the sense it led to a major policy shift onto the chronically homeless, okay? And that significant funding followed that. But the study doesn't tell us anything about prevention. So the question is, why the heck am I talking about this study, which tells us nothing about prevention? It's actually going to the far end of the spectrum and having a look at those people who are deeply embedded in it. Well, this is where the study by Benjaminson and Andrade is really important, because they applied exactly the same typology to a study of shelter users, but in Denmark. Now, if anyone knows anything about welfare regimes or welfare systems, they will know immediately that the welfare system in Denmark is much more comprehensive and far broader than what you have in the US. Okay, so it provides a really good contrast between two different welfare regimes in a study using an identical methodology. So what did they find? Well, in fact, what they found was identical patterns. They found about 80% of people were transitional users, about 15% were episodic, and it was actually a bit higher, about 15% were chronic users. In the Kuhn-Culhane study, it was about 10%. So, okay, the patterns are the same, but that's not the important thing. That's not what they were trying to get at. What was really important was the characteristics of each group. Unlike the American study, where there was a significant variation between the groups, there was no variation at all. Okay, everyone in all of those three groups had high and complex needs. Now, this is really important. I'm just going to get my slides up because I'll need to read this to you. This is important because what they essentially found is that in homelessness in countries with extensive welfare systems, that is broad and wide coverage, homelessness is far more likely to be concentrated among individuals with complex support needs, such as mental illness or substance abuse, whereas homelessness in countries with less extensive welfare system is more likely to result from poverty and housing affordability problems. Now, this has some really important implications when we're trying to think about preventing homelessness. The first thing it does, it shows us that welfare systems matter, and they matter a lot. Okay, in Australia and in the US, our welfare systems are thin and offer little protection. Thin welfare systems result in a much more heterogeneous homeless population, i.e. a population with a very vast range of characteristics, not only in terms of gender, age and so forth, but in terms of the level of their needs. We have people with complex needs, people with less complex needs and so forth. What this means is in countries with thin welfare systems, we require a far wider range of interventions to meet that broader population, and that results in a far more complex system. It also does something more sinister as well. In a resource-constrained environment, it can lead to competition between vulnerable groups. Who is the most vulnerable? Who has the highest needs? Is it young people? Is it old people? Is it singles? Is it families? Is it people with mental health problems? Is it people with substance use problems? Is it the long-term homeless? And who makes these decisions? And what's the evidence behind it? Vulnerable groups are effectively pitted against one another. It's another form of the deserving poor. Who deserves our assistance and who doesn't? And it's really worth mentioning something else here. It's worth mentioning Finland. Everyone loves Finland. No doubt many submissions will refer to Finland and suggest we follow their approach. The homeless approach in Finland relies on a strategy where the emphasis is on housing first. And that makes sense. And they can do this because their homeless population is both small and homogeneous. Most people have complex needs because they have a very extensive welfare safety net. It's also worth pointing out they've been pursuing this strategy for over 40 years. These things don't happen overnight. Finland has a generous and comprehensive welfare system that provides a strong buffer that reduces the risk of homelessness. Australia does not. In short, their safety net catches far more people than ours does. Australia has a different welfare system, and this has consequences in terms of not only the size of the homeless population, but also who becomes homeless. Policymakers here face a very complex challenge, and this has consequences in terms of the size and also the composition of that homeless population. I had a graph here which I wanted to show, which was basically, it was about funding homelessness services. The line, basically what we see is there's been ongoing funding increases since about the year 2002, and the number of people using homeless services has increased as well. But we're not seeing any impact in terms of reducing the number of people who are homeless. We're funding services, but we're not really getting anywhere in terms of making a decisive impact on the level, the aggregate level of homelessness. I'm going to shift my attention now onto Journeys Home. Now, I'm not sure how familiar people are with Journeys Home, but as I said, it's considered one of the best data sets in the world in which to model entries into and out of homelessness. And there's 4 reasons for this, and it's a really useful study in terms of prevention. Firstly, it's longitudinal, so we track people over time. It's got a large sample, 1,600, low attrition rate. Most people stayed involved in the study. Importantly, it includes at-risk and homeless people. Most studies look at homeless people or formerly homeless people. That's really hard to means it's really hard to understand transitions into homelessness or the onset of homelessness. Okay. It was also undertaken in multiple locations around Australia, about 36 locations. Now, that's important for one thing. If we want to understand the impact of housing and labour markets, you need variation in those markets to understand what sort of impact they're having in terms of homelessness. So Journeys Home can do that. And the final thing is it's got a really rich data set, asks lots and lots of questions, specific questions. Unlike, say, Culhane's and other studies which use administrative data, this was set up entirely to try and understand that, understand the onset. Journeys Home, before I go to some of the findings though, at a very high level, has focused research attention on the impact of random shocks. Okay, so random events that happen in vulnerable people's lives that precipitate or lead to the onset of homelessness. So random shocks can be economic, job loss and so forth. They can be familial or they can be health. These sort of shocks amplify existing vulnerabilities. The point about those shocks is they're not predictable. Okay, makes homelessness, understanding homeless prevention very tricky. The point about those shocks and understanding or starting to think more in terms of these random shocks is that we start to focus on events that are happening in people's lives rather than the characteristics of the people themselves as a factor to explain what's going on. Okay, so events matter, characteristics less so. Okay, just quickly, I have no idea of the time. I've clearly lost my plot in terms of the slides, but I want to look at one study just quickly that had that looked at the factors that increase the probability of entering homelessness and those that decrease the probability of entering homelessness. Remembering that Journeys Home can control for a wide range of factors. Now, of course, I've got the slide in front of me. None of you have, but I'll go through this. The slide essentially is looking at statistically significant effects of certain characteristics and experiences. Under the sort of the category of no effect, we have long-term health conditions. So if someone's got long-term health conditions, that has no effect, doesn't increase the likelihood that they'll either avoid or enter homelessness. What we've done though, in a paper that we're still working on, is we've had a look at health, but we've had a look at it in terms of whether a health shock can precipitate homelessness, i.e. a sudden change in health. So we've titled the paper Shocking Health, i.e. poor health or health shock. And it does look like a health shock, a sudden change to circumstances, one's health, can actually precipitate homelessness for very low income households. Okay, let's go through some of the risk factors. State care was a risk factor. That shouldn't surprise anyone. Having slept rough, that shouldn't surprise anyone. These are the sort of experiences or characteristics that increase the probability of entering homelessness. A recent job loss, a shock in terms of one's economic. Recent violence is a really important one. Alcohol consumption and drug use. But here's the twist. Things like state care, slept rough, alcohol consumption and drug use, they're significant, but only weakly so. Okay? They're important to understand, but they're only weakly significant. Okay, we've just got to keep reminding ourselves of these things. And there's reasons why we need to do that. We also could see the preventative factors. So I'll go through those. These are the things that decrease the probability of people entering homelessness. Education really matters. If you'd done year 12 or beyond, the probability of entering homelessness was much lower than those who hadn't done up to year 12. The amount of time you've been employed in the past mattered. Here's an interesting one. If you've ever been diagnosed with bipolar or schizophrenia, you were less likely, or the probability of becoming homeless was much lower than other similar people on the similar income status. Now, that's people are going to say, hold on, what are you saying? If you've been diagnosed, mental health is clearly a risk factor. What we think is happening here is, the key phrase here is ever diagnosed. So if people have been diagnosed, the chances are they're involved with some sort of support, okay, to assist them to deal with their mental health or other sort of their health issues. And that could be the thing that's making the difference. What may be emerging is that the real risk factor is those who have got undiagnosed mental health issues, okay? Social support is a really important thing in terms of reducing the probability of entering homelessness. Now, again, just remembering this sample is a sample of very vulnerable and at-risk households drawn from Centrelink, okay? So social support becomes really important. If you don't have social support, it boosts the chances that you will enter the homeless population. Then we have the two most important and powerful ones. The first one is community housing. Living in community housing is a really strong factor in terms of reducing the probability of entering homelessness. But it's only about a quarter as powerful as public housing. Public housing is by far, in terms of the magnitude of its effect, the most powerful factor preventing homelessness amongst disadvantaged and low-income households. So you can start to see that Journeys Home starts to sort of confirm many things that we've always thought, but really didn't have strong evidence for, but it also challenges some things. You know, I'll come back to it. Individual characteristics and experiences are only weakly significant. The risk in high-risk groups is weakly significant, and most people who become homeless are not from high-risk groups, okay? Just got to remember that. A lot of people are coming into this population and they won't have these characteristics that we consider to be risk factors. Sure, they're on low income and so forth, but those things tend to get pushed aside under the weight of mental health issues, substance abuse. There's a whole range of things going on here. I'm going to finish up now, and again, I'll just sort of apologise for my incompetence with technology. We have had a number of homelessness strategies, both state and federal. I've been around, unfortunately, far too long to say that I have seen quite a few of these. And it's fair to say that they've all failed. Yet we keep on investing in new, bold, innovative homeless services. No doubt this will happen again. And hearing what Kate said, I expect we'll get lots of bright and shiny new things making lots and lots of claims. This is a great shame simply because you cannot end homelessness without a strong, clear focus on prevention. And that involves strengthening our welfare support system and making substantial and ongoing investments in social housing. So thank you for listening. And again, my apologies. I can close my slides now, though.
Thanks so much, Guy. It's always, sometimes Zoom just throws up something that challenges you. Can I ask the first question? Can I just ask, that was really interesting about the difference in the homeless population in Denmark compared to the US. Do we have, is the way they measure homelessness similar enough that we can get a sense of what the rate, like whether or not Denmark has a lower incidence of homeless per sort of head of population? Oh, you're on mute.
Comparing between countries is problematic because of different definitions. Saying that the Americans use a very limited definition, sheltered and unsheltered. Okay, so you're either in a sheltered or you're sort of sleeping rough. So I know Lars has done some work looking at the differences between those, and the rate is substantially lower. But you have substantial issues, not only with definition, just measurement error. It's a problem. So this study is sort of unique in the sense of similar methodology, similar data sets, but in terms of the incidence, the empirical data is there. But I suggest, I would recommend anyone walk around Denmark, walk around America, and you really, you don't need to be a researcher to say one country's got a big problem, one country's got a little problem.
Yeah, that's a really good point. So does anyone else have any questions?
I'm going to ask a question of Guy. It was really interesting, but hugely challenging. I'm just going to look at my notes. When we looked at the risk factors and those that decrease the probability, when you said that an early diagnosis of mental health, because I too have been working in this field for a long time, and I swear to God, just about every single rough sleeper I've come across has told me they've had a diagnosis of schizophrenia or schizoaffective disorder, any of the high level psychiatric disorders, and they've often been hospitalized multiple times. And I guess in Australia, as you would know, we had that moment in the 90s when we deinstitutionalized people. And for better or worse, that seems to have provided us with a rich population of people who just continually move through hospitals, EDs, and private clinics, and then move back into the population. And I do understand that having support can prevent homelessness, but it's almost like you've got to have so much, so many complex, robust workers to provide that support. And we're seeing that now with NDIS training, I suppose.
Okay, look, I think it's a fair point when you have a look at the chronic population, which are sometimes rough sleepers and sometimes not. So let's refer to it as sort of the chronic homelessness. You see much higher rates of substance misuse. You see much higher rates of mental health and profound mental health issues, along with a whole range of other disabling sort of conditions. But remember, Journey's Home's using a broad definition, and that rough sleeping population is actually quite a small segment, or the chronic population is quite a small segment. It's also the case that it may not necessarily be the mental health problems that driving. It could be other factors in their life. It could be a lack of social support. It could be a whole range of other factors that are actually contributing to it. One of the most interesting papers that's come out of Journey's Home looked at substance misuse and sort of said, hold on, that doesn't seem to be driving the onset of homelessness. It seems to be keeping people in there, and we've done other work which shows that people develop those problems more often in the populations once they become homeless. And again, we know that people's mental health conditions often worsen when they're homeless. So it's a complex chain. And so part of here is just recognizing the nuance. Totally agree with your point. But I also swing it back and say, when you've got a broader definition of homelessness, the incidence of mental health, and also as a protective factor, seems to be, how should we say, shaping the dynamics a little bit in different ways than we thought.
Thanks for that. Any other questions? While people are thinking of a question, I had a question for Jackie. Just thinking about what Guy's saying about shocks, rather than just being like the absolute level of poverty, but income shocks or health shocks, which obviously often become income shocks. I'm just wondering if you can say a little bit more about what we know about the breaching regime in the income support system and what impact that might be having on homelessness. I mean, I'm not quite sure how many people are getting breached or how long potentially those breaches last. Obviously, it's one thing to sort of lose a couple of days of income, but if you get cut off Centrelink for an extended period of time, your chances of becoming homeless, I imagine, are much greater.
Yeah, thanks, Kate. Yeah, we've just actually been talking about whether or not we need to do a piece of research which actually looks at these links, because I'm not aware of there being anything done recently on this particular issue. One of the things that we were thinking about when we were thinking about how would we design such a thing is that, as I understand it, although payment suspensions are very common, in fact, there's data that's just come out in the last couple of weeks that show, I don't know, nearly half of all the people on JobSeeker have received payment suspensions in the last reporting period. So they're having a delay in their payments are being put on hold and periods of time without income. But the proportion of people who are actually going through to being breached and having their payments cut off is only about 5%. So it's quite a small group who are getting to that point in terms of the penalties. So yeah, we're going to have some further discussions with some of our colleagues at UNSW that we work with through the Poverty and Inequality Partnership about whether there are ways to explore the impact of the suspensions, which are far more common on tenancy and homelessness. But, you know, there may well be many people on the call who see this evidence firsthand all the time, and I'd be really interested to hear about that. One thing we are doing just in terms of, policy asks at the moment, and we've just got a meeting with the Minister this week of Employment, is calling for a halt to payment suspensions at the moment, given the cost of living crisis, the housing affordability crisis, and the problems with the system and its administration, which are causing just such a high number of suspensions. So that might be something that members want to pick up in the context of the National Plan and homelessness prevention.
I just wonder, as a question to the group, what sort of, in terms of working with people who are experiencing homelessness, what you might have noticed. I know that people's not being eligible for disability support pension is often an issue, and then people struggling to manage the requirements of the job seeker payment, and so then getting payment suspensions or getting breached. And it's very time consuming, of course, for homelessness sector workers to try and then work with Centrelink to resolve those issues. But would anyone like to talk to that, who's had that experience or can give a sense of how prevalent it is as an issue? Trish, I think you were going to jump in there.
Thank you so much. Please excuse me. May I leave my camera off if you don't mind? Sorry, I don't mean to be rude. I work in the homelessness, I work in the family violence sector, and I'm the senior housing worker here at NSFVS at Berry Street. But what I see all the time is not only that, you know, how much time is taken up in trying to resolve those issues, but the incredible stress that places on people who have been suspended or breached, and then the knock-on effects to every other part of their life. So is their centre pay late as a result, or their ability to even pay their rent or any other costs that they've got associated? Are they able to feed themselves or their pets, you know, and then coupled with the immense stress of being homeless or not being able to pay your rent, then of facing other issues that are happening in your life, such as family violence or, you know, problems for your children or whatnot. It's just incredible. Immense.
Yeah, that's a really important point, Trish, and it reminds me of some other work that I know Guy was involved with about mental health being a consequence of homelessness as much as it is a driver of homelessness. So then, of course, I think also an issue that keeps people stuck in homelessness if they end up so stressed, have mental health issues, and then are going to really struggle to participate in paid work. Did you want to say anything more about that, Guy, about how mental health issues acquired as a consequence of homelessness entrench people in a situation of being homeless?
Yeah, I'm sort of happy to. I mean, what we clearly see is there's people adapt and try and survive homelessness in the best ways that they possibly can. For some people, just to cope with the sheer brutality and misery of it, that can lead to substance use, for instance. So we see a pattern where substance use isn't that strong, and I mean, it's implicated, but it's not that strong a predictor of homelessness. But we see disproportionately high rates amongst the population. And for many people, they may come in, they may use drugs and so forth, but it becomes problematic once they're in the actual population and then becomes a barrier to get out. Mental illness, I mean, this is a brutal stigmatized experience, and if you have a propensity towards mental health issues, and even if you don't, just the sheer anxiety of not knowing where you're going to go, where you're going to live, what you're doing with all your goods, am I going to get beaten up, all those sorts of things. I'm tapping into all my friends' resources, I'm losing this sort of social and economic capital all the time. That can really affect people's sort of mental health issues. We saw a really interesting pattern where amongst people who are exiting homelessness, the level of psychological distress declined, only with women, but men became more stressed when they left the homeless population. And part of that was because of the struggle of actually maintaining a home. So these are really sort of dynamic sort of circumstances and situations, but they're also contextual. And so, I want to come back to this sort of thing. What's happening in people's lives, the events that are happening in their lives are really important. So all of these things are going on, and it's not to sort of say some are more important than others. If we want to try and get to these and sort of add to the well-being within the community and prevent a lot of the downstream consequences that happen as a result of homelessness, you need to think about prevention. There is no point, 20 years ago, we used to point, there's no point putting the ambulance at the bottom of the cliff. It's expensive, right? So put a fence up. For 20 years, people have ignored it. I mean, I'm going to just say one thing that, I probably shouldn't, but I suspect the issue around the housing crisis is now changing quite noticeably as it's becoming more of a middle class problem. Now, whether that means we're going to get some different approach, I suspect that because this is no longer just an issue which people on lower incomes are dealing with, now people on middle incomes, I suspect we're going to see more policy attention. But that's just an opinion. Sorry, Kate, I've rambled there.
That's great. Just actually, while you're there, one more question, which is in the Journeys Home data, was the drivers into homelessness different for any of the cohorts? Like, I'm just thinking particularly of young people, and then probably women as well. Whether or not violence was more of a predictor of homelessness for those groups.
I don't think I can't speak with clarity or certainty on that. I do know that when we looked at psychological distress, though, men and women handled that or experienced that in quite different ways. Women's psychological distress was higher on entry, but lower on exit. Men's was reasonably high on entry, then they seemed to manage and adapt to the experience, but on exit, they struggled a great deal. So, I mean, I think there's more work to do on that, but it hasn't been done.
Anyone else in the group? Thanks, Guy. Would anyone else in the group like to talk to those issues if you're working with a particular group about what you see in terms of your reflections on working with a particular group might prevent homelessness for that group of people?
Can I just quickly jump in about the Centrelink and Job Network provider issue? So working at the moment with a young woman who's now pregnant, has had a long history of homelessness and is not really good with her reporting or just following up on even appointments with me. So, and it's time consuming work, but I love the intensity of it. I remember saying to her, look, let's meet your job network provider so we can talk about what my program is doing with you to provide you with safe, affordable housing. Now, she's been breached multiple times, and often I'm in the car with her and she's going, oh God, I forgot to ring in today. So she'll ring in and I'll be able to have a conversation with that job network provider. But we've been able to go down there and introduce the agency we work with and say, this is the service we provide. And, by breaching her or stopping a payment, once her payment's late, we'll just have to start all over again and start doing the whole housing thing. It's about, it is a big, big relationship building capacity. We've worked to the point where we now get referrals from Centrelink for young people under 25 who are at risk of breaching and may be homeless or have mental health issues. And look, I've worked in this particular area for 20 years now, so we've got good relationships with Centrelink social workers. But I believe if you build the capacity of job network provider workers and Centrelink to understand that all of those policy issues can impact homelessness and in fact create another tier of homelessness, then you're going to get a better response. And yes, I know it's time consuming, but I can only do one person at a time, I guess. Yeah.
So, Kate, if those links with Centrelink happened at a local level?
Yes, I actually did a social work placement at the local Centrelink, and I've kept those, that was 20 years ago, and I've kept those networks going, and it's surprising who still works there. But during COVID, they had monthly meetings. So we've had the Centrelink community engagement workers at Community Information and Support, YSAS, all those kinds of places in our community, and we will take clients there. And we've built relationships where they can call the agencies in the area and ask for assistance for clients who might need it.
Yeah, that's really interesting, because I think obviously the best case scenario is that Centrelink has policies that don't unduly, breach people and put people who have limited capacity actually to engage in those processes through processes that are beyond their capacity to engage. But a sort of mitigating factor can be that if there's either social workers at Centrelink who can ensure that people are not breached if it's just a more accidental non-completion of a task, or support people to access the full scope of their entitlements, then that can be quite protective. Likewise, I suppose resources in the community sector like yourself, or in homelessness services, helping people navigate those systems. Someone from Harvey Bay Neighbourhood Centre. Oh, you're upside down, but that's okay. Oh, now you're right way up, but you're also on mute.
So yeah, I'm Narelle. I'm from Queensland. At our neighbourhood centre, we're not a responsive service to homeless people, but we do have a lot of drop-ins, and we do a lot of our programs work with people who are at risk of or homeless. I actually also run a tenancy advocacy service here. So I guess the prevention talk that Guy's been talking about, the data and the research there, was really interesting to me. Excuse me. I guess the random shocks, I don't have so much of a question or a comment, but yeah, they're the calls I get with my tenancy advice service. An incident has happened. They're now at risk of homelessness. Primarily it could just simply be they cannot find another house. So I know that housing isn't the answer, building another house and housing this family. But I guess it's my question, or my thinking is, how, and I have to do it anyway within my role, how do I help that person respond to that one random shock? How do I, it's, and I see the flow on, because they're now at risk of homelessness. And if they get into homelessness, couch surfing, sleeping in the cars, that type of stuff, short-term accommodation, then it is more difficult for them to get out of it. So yeah, that random shock really resonated with me.
Can I just say something there, Kate?
Yeah.
It's always pleasing to hear when your research isn't too disconnected from reality. I worry sometimes about, if we can start thinking about sort of shock, that policymakers are going to turn this about lack of resilience in individuals. And that's not what it's about. I mean, resilience matters, but it's not about resilience in individuals. You ask what you can do. I can't answer that, but I know if the system was stronger, the welfare support system was stronger, would be in a better position to do something about that if you were seeing that at all. Right. So we need more resilient systems, not more resilient individuals. Okay. And that's the challenge that we face, is that we're going to get pushback from this. They're not prepared to. I mean, Jacqueline and her team of ACOSS have been pushing for years for increased income support. Right. It's a challenge, but part of, trying to focus on prevention and talking about prevention is that by almost by definition, we come to high level systems that we've got to fix. And that's it's a concern for all of us here for reasons, but it's also a concern for the broader community. So I'm not an advocate or so forth. I'll leave that to others, but these are issues which are seeping out more broadly and now starting to suck in more people that in the past. I can just give you an example. We're doing a large study of a service down here, right? We've got 10 years of the 6 front doors to homeless agencies, right? So it's 70,000 households we've looked at. There's a couple of really interesting things. One of the interesting thing is over a 6 or 8 year period, I forget the actual time frame, the number of people who are working and presenting to homeless services has doubled. It's gone from 1 in 20 to just under 1 in 10. Being in a job is no longer the protection against homelessness and housing insecurity that it once was. So, again, probably rambled a bit, but it's a big issue, and we can't let the governments or bureaucrats get away with dealing with it with systems responses only, or service responses only, I should say.
And Guy, just, from that as well, from my perspective, it's not always a community service response, the community services to respond to. I see discrimination clear as day in the real estate industry, things like that, so there's just, with homelessness, there's so many different angles we have to try to attack this at. It's a lot.
But that's why we've got to focus on the two that are most likely to have an impact in terms of the aggregate number of people experiencing homelessness. And it's your welfare systems and housing markets where we've got to start. We won't get rid of it. We won't solve homelessness entirely, but we'll make it a much more manageable problem, issue, and one which we can respond to much more effectively than we currently are.
Can I just echo that point? So if people had adequate income support and there was housing available in the market that they could find, then most people would be able to weather a shock as a result of unemployment or a result of, having to move out of their tenancy, just by relying on income support, or if it's a housing shock, being able to secure a new tenancy. And if they needed a little bit of extra help, then perhaps they'd be at the Hervey Bay Neighbourhood Centre or a homelessness service, and a worker would be able to help them to get a new tenancy, because there'd be tenancies out there in the market that they could access. And so they wouldn't, in that scenario, need to go via homelessness into the housing that they needed. They could go from tenancy at risk into a new tenancy and bypass homelessness. And that's really part of what I think we need to talk to the government about in terms of the work that homelessness services can do. So there's those overall policy reforms, but there's also, I suppose I would really call that early intervention rather than prevention, but that the work that homelessness services can do in preventing homelessness via a service response. But you can only do that if people have adequate income and there's housing available to move people into. Any other questions? Otherwise, I'll pose some questions to you as the group. So one of the, we have got a separate session that's going to talk specifically about prevention of homelessness for children and young people. But I did just want to flag in this group, obviously, particularly children become homeless, not so much because of they can't afford housing, but often because of abuse or neglect in the home or family violence. Issues around coming out as LGBTIQ+ and family rejection, all of these issues around family conflict. So I just wondered if anyone wanted to talk to, perhaps working in that space, talk to some of the issues that might need to, or policies that might need to change, government investment in areas that might need to change to better support families so children are not becoming homeless or young people are not becoming homeless.
Oh God, I'm going to go again. we see a lot of young people from out of home care, from state care. We see way too many. They've usually got intellectual disabilities. And as I like to say, when you're 18, your choice is homelessness and or the justice system. So that's where we just see an overrepresentation. I'm in the southeast.
Hey, can I just ask about that? Because I think you mentioned something that made me think you're in Victoria. Why are children coming through out of home care now and not getting an extended care response?
Well, there's 4 orders that you can be on to access better futures. So we're often seeing young women at the age of 18 who have been in out of home care when they were, I'm just thinking of examples, 10, 11, 12, 13, returned home, returned back to mum and stepfather. So there is a theme there, and that relationship never quite healed. And they've often started an early trajectory of couch surfing and just never going back to the family home. Yeah.
Yeah. Thanks, Kate. Trish, did you want to jump in there?
Thank you. I think that given that family violence is one of the main, or it's one of the biggest causes of homelessness for women and children, I think that I think there should be a greater portion of public and community housing set aside specifically for that cohort, whether it be women and their children or young people specifically that can show that they're escaping family violence.
Particularly at Berry Street, because I know you do a broad range of work. What sort of I suppose better investment earlier down the track? So you're talking about, of course, responding to people once they've become homeless and getting priority access to social housing. But I'm just wondering, what your reflections might be on the level of support that families get before they end up either a woman and a child homeless or a child homeless on their own, and if there needs to be, better investment in family support so that they don't end up in that place.
I don't know that I am the right person to comment fully on that. I think that the problem is whether or not people fleeing family violence are actually aware of what's available to them, and being in a safe enough position to reach out for that support. I think that's all that I'd be comfortable saying at this point, Kate, and maybe reflecting on that a bit more before saying more, if that's okay.
Yeah, no worries.
Yeah, I think there's always space for more support, more funding, et cetera, et cetera. Absolutely.
Does anyone else want to jump in, particularly around family violence?
I'll just add from Harvey Bay again, sorry. We conduct a yearly survey with all the high schools up here. That's 1,000 youth participate in that annual survey. We've been doing that for the past 4 or 5 years. Just one of the highlights that come from that when we talk to the homeless cohort with that survey is 3/4 have anxiety about returning home if there's been a breakdown in the family dynamics, family relationship. So a lot of the services we have here for young people really do focus on mental health and mental well-being and feeling safe in their home.
And I think you mentioned before, was it Narelle, wasn't it? Yeah, about the issue, which was the next question I was going to ask, about discrimination in the rental market. And I'm just wondering if you can say a little bit more about who you see coming into the neighbourhood centre who's experiencing that rental market discrimination.
It's really broad. It's very broad right now. I mean, prior to this housing crisis that we're calling it, it used to be low income, low education, the stereotypical dysfunctional family, I guess you could say, is what we know that families were being judged as part of that rental application process. Yeah, so we saw a lot of low income come in. We'd hear a lot of stories about some of the tenants who were coming up to our region. We don't have a high multicultural population here, but if they were from other races, yep, it was taking a very long time to be approved for a property. And then now it's very broad. We can have dual incomes and they cannot be approved for property. So it's really, yeah, changed our landscape up here. We have a lot of high rent increases. That's been one of our big problems, and low social housing, community housing stock.
Yeah.
And as a response, that we're always, you know, as a community centre, we can be broad when we're looking at grants and funding and programs and whatnot to help respond to those type of things. So we're just trying to identify better. You know, we want to run tenancy education workshops to, you know, the tenants or potential tenants with information on how to be good tenants, how to sustain tenancy, what we know the real estate are looking at when they're looking at you if they don't want you to rent the house. So things like that. We're also in a tourist town here, so we know that judgment from the short-term providers here is very high as well. We've been told flat out they will not rent to people on a short-term basis if they have a local address on their driver's license. So there are a lot of barriers, and we can't always pinpoint it to discrimination, but yeah.
Thanks for that. Any other questions or points of discussion? Otherwise, I think I might wrap up. No worries. Well, thank you all. I think that's been a really rich discussion about all of the issues in prevention. And thanks very much to Guy and Jackie for your input. And we'll circulate the slides to everyone who participated. And then the other thing is just to point you to the Homelessness Australia website, the advocacy section. So there's a guide there about writing a submission to the National Housing and Homelessness Plan. So I would encourage as many of you as possible to have input to that process and to make the arguments that you've heard today about what needs to happen to prevent homelessness. And then as well, of course, I'm sure you'll want to say some things about what needs to happen in the response to homelessness as well. So all of the information is there on the website, or if you haven't been getting the Homelessness Australia e-bulletin, you can sign up for that on the website too. But I suspect you have been getting it because that's how you would have found out about the event today. So many thanks to all of you. There's a few other sessions about with a similar format.